Cord blood banking has become a very popular thing to do when you have a baby. Basically, what cord blood banking is, after they cut the umbilical cord, after your baby's delivered and they cut the umbilical cord, they put the blood that is in the umbilical cord into these little tubes. They put them in the tubes and then they send it to a lab where they check to see if your cord blood is something that can be utilized for stem cell research or for um, potential help for your family in the future. So they'll check and make sure that everything is good with the stem cells, that it can be used, and then they'll freeze it in a big bank of blood, which kind of sounds actually kind of creepy, but it's not. It's just a big freezer full of this cord blood that can then be used in the future. It can be used for things like leukemia. I'm sorry, for potential cures for these things. Leukemia, they're coming out with information about autism and cord blood banking and how stem cells can potentially help with those delays, among a bunch of other things. Honestly, there's so much nowadays that they're doing with stem cell research that it's crazy what they can do, and it's definitely something that you'll want to look into. Usually it costs about $1,000 the first time, the initial check and bank, and then after that I think it goes down to sometimes $300 a year, possibly more depending on where you choose to bank your cord blood. So there's a few different types of cord blood banking places out there, and that would be something that you would want to research as well. But it can be a great option for families, especially those who may have concerns about any diseases in their family, cancer, things like that. It can be very helpful. Another thing I want to talk about is delayed cord clamping. So delayed cord clamping started to become popular probably about 10 years ago. And it's really picked up pace probably in the past 5 years. Basically what they do is they wait to cut the baby's cord after birth for 1 to 3 minutes. Sometimes it's about 30 seconds depending on the practice of your OB or your midwife, but the recommended is between 1 and 3 minutes. They'll let the cord pulse and get to a certain point where they feel comfortable cutting it. They'll cut the cord, and you can almost see the cord go completely white. Coming out of your body, the cord is like a purplish blue color. It's filled with blood. And then after a certain amount of time, the blood goes back into your baby. From the placenta, goes into your baby. It's about a third of their blood supply, and it's an iron-rich blood, so that can be very helpful for their heart development, and just things like that. Overall, it seems to be a good practice as far as the health of your baby goes. So something that some people ask is, can you do cord blood banking and do delayed cord cutting? Yes, you can. There will be blood in the cord if you delay it. Obviously, you wouldn't want to delay it for hours, but waiting a minute and then collecting the blood is definitely something that can be done. There will be blood in the umbilical cord at that time. So both of those things are an option. Overall, they've just seen that delayed cord blood banking, delayed cord cutting, talking about both of these things at the same time seems to be getting me all jumbled, but delayed cord clamping helps the baby transition into this living, breathing world a little bit better because they have that iron that doesn't come naturally from breast milk. So they have the ability to cognitively, progress in a different way than maybe the babies that do not have the extra iron that first couple of days after birth, because obviously your blood will replenish itself, but having that first go around can be really helpful. So it's something to think about when you have your baby.